CEN Study Guide YouTube. Question 1. A patient involved in a high-speed motor vehicle collision presents with hypotension, abdominal distension, and a positive FAST exam. The nurse anticipates emergent CT scan, immediate laparotomy, observation in the ED, administration of vasopressors. Question 2. A 28-year-old female presents with lower abdominal pain and vaginal bleeding. She is 8 weeks pregnant. The nurse suspects appendicitis, ectopic pregnancy, pelvic inflammatory disease, ovarian cyst rupture. Question 3. A patient taking sildenafil, Viagra, 2 hours ago now presents with chest pain. Which medication is contraindicated? Aspirin, nitroglycerin, morphine, atorvastatin. Question 4. During a cardiac arrest, the first dose of epinephrine should be given immediately after the first defibrillation attempt, after 2 minutes of CPR, before any defibrillation attempts, only after obtaining an advanced airway. Question 5. A previously healthy patient presents with acute onset of shortness of breath, hypoxia, and normal chest X-ray. The nurse's primary differential diagnosis is pulmonary embolism, asthma, pneumothorax, myocardial infarction. Question 6. A patient presents after a house fire with dyspnea, sooty sputum, and a brassy cough. The priority nursing diagnosis is fluid volume deficit, impaired gas exchange, ineffective airway clearance, pain. Question 7. A post-cardiac arrest patient remains comatose. The nurse prepares for emergent coronary angiography, therapeutic hypothermia, targeted temperature management, immediate extubation, administration of TPA. Question 8. A patient presents with fever, chills, and a productive cough with rust-colored sputum. The nurse recognizes this as consistent with viral pneumonia, mycoplasma pneumonia, pneumococcal pneumonia, tuberculosis. Question 9. A patient presents with a fever, headache, and neck stiffness following a recent tick bite. The nurse suspects Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, anaplasmosis. Question 10. A patient presents with a sudden onset of right-sided weakness, facial droop, and slurred speech. Last known well was 2 hours ago. The nurse anticipates emergent CT scan of the head, administration of aspirin 324 milligrams orally, continuous cardiac monitoring, all of the above. Question 11. A patient presents with acute onset of tearing chest pain radiating to the back, along with a blood pressure difference of 30 millimeters of mercury between arms. The nurse suspects acute myocardial infarction, aortic dissection, pulmonary embolism, pericarditis. Question 12. A patient presents with urticaria, angioedema, and difficulty breathing after receiving 4 contrast dye. The nurse's priority is to administer diphenhydramine, administer epinephrine, start in 4, call a code. Question 13. A patient with 3rd degree complete heart block is bradycardic and hypotensive. The nurse should anticipate atropine 0.5 milligrams for push, transcutaneous pacing, adenosine 6 milligrams rapid for push, amiodarone 150 milligrams for. Question 14. A patient is placed in 4-point restraints for violent behavior. The nurse's ongoing responsibility includes documenting the behavior requiring restraint, ensuring a physician's order is obtained, providing regular monitoring and release of restraints, All of the above. Question 15. A patient presents with a high-pressure paint gun injury to the hand. The nurse's priority is soaking the hand in warm saline, icing and elevating the extremity, preparing the patient for surgical exploration, administering a digital block. Question 16. A family member of a patient in cardiac arrest insists that everything be done to save the patient, despite the patient's living while declining aggressive measures. The nurse should follow the family's wishes, continue CPR until the physician clarifies the advance directive, stop CPR immediately and contact risk management, ask the patient what they want. Question 17. A patient in the ED is in ventricular tachycardia without a pulse. The nurse's priority intervention is administer a miodaron 300 mg for push. Perform immediate defibrillation with 120 to 200 J biphasic. Start chest compressions. Establish an advanced airway. Question 18. Which finding is most concerning in a patient with suspected right ventricular infarction? Hypotension, jugular venous distension, clear lung fields, ST elevation in lead 3 greater than lead 2. Question 19. After a fall, a patient on warfarin is found to have a subdural hematoma on CT. The nurse anticipates administering clopidogrel, vitamin K, fresh frozen plasma, both B and C. Question 20. A patient develops a sudden, severe headache described as the worst headache of my life, along with nuchal rigidity and photophobia. The nurse suspects migraine headache, tension headache, subarachnoid hemorrhage, meningitis.